So now you got a situation, and by the way, the number one predictor of drug launch success is medical affairs. So the FDA's commissioner, Marty McCary, put out a statement about this National Priority Review Voucher Program to try to expedite drug approvals, which, you know, on the face of it seems like it's a good thing, right? But one of the things that I'm wondering, and I'd like to hear your perspective on, is now this is going to shorten the timeline for that pre-launch phase, if you think about it, right? Before, as you know, a lot of MSL medical affairs teams, they're taking 12, 18 months before launch to go out and begin to kind of prep the market for the launch.
That's right.
But now that time's going to shrink, and that's the first thing I'd like to hear your perspective on.
There's a lot of stuff that goes on prior to launch, like you said, that's very, very critical for a successful launch.
Absolutely.
Right.
Yeah.
And so I don't think just because the FDA might allow a much more shortened timeline for like a review process and approval, pharma and biotech clients are going to have to think very, very critically about, just because the review time might be sped up, they're not necessarily going to want to launch right full scale, or they might want to adopt different launch strategies where they might launch very softly in one neck of the woods and then do a full launch later, because it is very important. All that pre-launch activity is very, very important.
Absolutely.
For having a successful launch, and there's no way to get around that.
So now you got a situation, and by the way, the number one predictor of drug launch success is medical affairs. So now you have a situation where this is truncated, this pre-launch phase. So I think it's going to put a greater, responsibility on medical affairs leaders to make sure that their MSLs, their medical affairs team, is much more skilled now. Because now you have to be even that much more effective if you want to make sure your drug launches successfully.